Just got to go to Lillian Posadas for a hospital update in the midst of this public health pandemic. Good morning, Lillian. Thank you for joining us.
Good morning. Morning,
Hi.
Guam.
And I guess we did hear a little bit. Well, we heard a lot from Dr. Jolene Uggan, but if you could just run through the census real quick and then maybe give us any more info on the deaths that we saw over the weekend.
Okay. We have right now 48, a total of 48 individuals in the hospital. Of the 48, 14 of them are at the ICU level of care. And of those 14 individuals, there are 12 on ventilator support. As far as the death over the weekend, fortunately we did not have any last night, so thank God for that. But we did have quite of a, losses, several losses of individuals to COVID, and so I've kind of lost track how many already, but I think the last one was a 95-year-old gentleman, and then prior to that, it was a 59-year-old gentleman, and now I can't even remember
Yeah,
the other
90. Yeah,
ages.
Right.
58, 91
Yeah, 91.
year old man.
Lillian, we know it was at the Naval Hospital, but we're just asking if you have heard any other information about this 10-year-old boy who passed from COVID complications over the weekend.
I really have honestly don't have any information on that individual, the 10-year-old. I'm just assuming that perhaps it was Naval Hospital was the nearest facility, and maybe the 10-year-old was having probably some severe respiratory emergency situation that they needed to bring him to the nearest emergency facility. And so I'm assuming it's a civilian humanitarian, or that the individual is a military dependent.
Yeah.
I have no information.
Right. And then going back to the 95-year-old, and I don't know how much of this you can confirm.
91.
I'm going back to the 95-year-old who passed, I think, at the end of last week.
Right.
Is he
Male and
part of a
female.
married? What was he part of a married couple that's hospitalized because they have COVID?
That is true. That is correct.
And I just heard the most heartbreaking and touching thing that they were able to be isolated together because they're husband and wife and do
They
things.
were, but then I think, if I remember correctly, he was discharged and then came back. And so they were not together in the same room. I think primarily because of his condition, plus he needed a different type of oxygen, supplemental oxygen. I think that's what I remember hearing about his case.
Do we have any other couples who are hospitalized with COVID?
There is another couple, yes.
Elderly?
Elderly, uh-huh.
What about any pregnant COVID patients?
We had, actually, we had two individuals, two women who delivered their babies, and they did very well. We kept them isolated, and we kept the newborns also in the nursery isolated. And, fortunately, both babies got discharged home. The test came back negative on the two infants. Yes.
Lillian, is there any I guess during the first wave, we had seen efforts to I want to say increase space for the morgue.
Right.
What are we doing anything currently?
About
The morgue?
the morgue
Yeah.
for the expired bodies.
Yes.
Okay, we do have that 40-foot container right outside of the CME office, Chief Medical Examiner's office. And, it's in between our parking and their parking. So it's right there by the cliff site. And we have used it. We used it last week. We had 8 expired bodies in there. And so I don't know today because, oftentimes the funeral home, they come and they, pick up the remains for processing of burial or cremation. And so this morning, I'm not quite sure if the remains are still there or if they've already been taken by the funeral homes.
So it sounds like we're utilizing that space that was, I think it was stood up as part of the mass casualty plan, right?
Correct. It was stood up for the mass fatality.
The container, is it, I don't know if it matters, but is it non-COVID expired bodies or COVID
Uh,
or,
they were non-COVID is what I understand, because
Right.
our morgue, CME morgue, I mean, not CME, our GMH morgue, which is non-COVID, it was the full to the capacity. And so my understanding was that it was for non-COVID remains, human remains.
okay. Can we follow up then? We had asked Dr. Uggan about the um, shortage of staff, and I know we had spoke with you about it last week about this possible extension of the DoD medical staff, because I know you guys were working up against a timeline, a deadline.
Right.
So was there any word whether or not this extension was going to be approved, or any movement on trying to get this contract for additional medical personnel?
Sure. We'll start first with the DOD. Yes, we requested, I discussed it with the governor and with Admiral Minoni when he did a site visit last week, the possibility that we'd like to extend for another 2 to 3 weeks if that's possible. This is also the first half of the team that we requested. We requested about 36 CCRNs that we needed, and so we received the first half. So there we're also in discussion with the authorities and the representatives from DoD if the second half, if we are going to receive the second half, or that we extend the first half that we have on board right now. So those are the two options. While we're doing that, we're also working with a staffing solutions company, and I just received this morning pretty much about 80%, 90% of the final version of the agreement. They incorporated the clauses and provisions that we had sent them in terms of our local procurement law. We want to make sure we have those clauses in there. And so we're reviewing it now. We just received it this morning. We're reviewing it, and we're having also legal review it. And hopefully that we can come to a final draft by today, and we send it back to them, and we'll see what they say. And if we sign it by tomorrow, we have the governing body sign it, and the legal counsel gives us a blessing, then we may have an official contract with them. And the target date, we're still shooting for the 21st of September, that they can then provide us with the additional hemodialysis nurses that we need, the additional ICU, CCU nurses that we need, because even though, we have this understanding with GRMC that we will not take non-COVID ICU patients. When they come to our doors, we take care of them. And so we still have 3 non-COVID ICU patients that we're managing. And we're trying to work with GRMC, but I know that they're challenged also with critical care nurses. And so, we're holding them there here. We're taking care of them as best we can. Even though, we said we're not going to handle the non-COVID ICU patients, they really have no choice. When they're here, we take care of them.
How many nurses are total medical personnel are we talking? And again, is it going to be? Are they going to be going to GMH, or are we going to split them up with GRMC?
The nurses that we're requesting from the staffing solution
Yes,
agency.
yes.
Okay, well, we're starting out with GMH because that's the agreement that we have. And so we're seriously thinking that, GRMC needs help also. So we're going to try and help them out by either assigning our staff to help them over there, or that we may be able to assign some of the travel nurses that come on board to their facility. And I'm also going to be talking with the leaders there at GRMC, because they utilize travel nurses from these staffing solution agencies. And so, the other option is they can increase their staffing from the agencies. We've requested to increase some of our travel nurses that we currently have a contract with. So we're doing all kinds of things in tandem.
All right. So you said you're looking to nail this down by the 21st of September. Is that within the 30 days?
Before the 21st, because that's when we
Okay.
would like to have these nurses on board.
Right. Is that
So we
before
will
the
have
30 days expires with DOD?
DOD, their expiration is the 30th of September, is what I understand.
And so if you guys get this contract signed before the 21st, I remember you said that there were like 100 nurses that you were trying to get to recruit from off island, and they could be
Correction.
deployed here within a week. So is that still
No,
the plan?
not
Or?
that they have, not that we requested 100. What this agency initially told us is they can deploy 100 nurses.
Right.
Because that's what they do in New York, in Washington, they deploy 400 nurses to those states. And so initially they said they can deploy 100 nurses to Guam.
So what is the agreement that you guys are looking at, and how many nurses or medical staff?
Well, the agreement
Again?
didn't say how many, but initially what we're requesting is that we're requesting for 8 hemodialysis nurses. We're requesting for 20 ICU, critical care nurses.
And can they be deployed here within a week?
Well, that's what they're planning. That's what they're shooting for. They are screening already the applicants. They're going through this competency review and taking a look at their demographics to see if they're going to be a proper and successful fit for Guam Memorial Hospital. So that's what they're doing
Okay.
on their end.
And how much is this going to cost, and what's the funding source?
The funding source is we're going to use FEMA. We're going to apply for FEMA, but upfront we're going to have to, cover the cost. But we're also working with FEMA, HHS, to see how they can, expedite and facilitate the funding stream to GMH. So we will have, support and funding backup from FEMA, and we're also looking at the CARES funds.
Okay, and I'm sorry, you didn't say how much?
I did not say how much because we're still negotiating it.
You have a ballpark figure?
Well, the total amount, I don't have that total amount because it depends on the number of nurses they send us. But what we're negotiating is anywhere from $175 to $195 per nurse, per hour per nurse.
Would we be able to, would we be able to use the CARES Act funding for that?
Well, the CARES Act, according to the FEMA, is that we can use the CARES Act to help us with the co-share.
Okay.
Because remember, FEMA will, for the public assistance, we can get 75%.
Right. Is there anything else going on at GMH?
Always.
That's the point we're at, Lillian. We're
Oh
like,
my gosh.
you tell us, because
Very professionally from Dr. Ogden, who is a clinician. She's at the front lines with the staff. She really knows the details. And so you heard it from her. Again, please, everybody stay safe and keep the social distance and wear your mask all the time.
She did, though, ask me that she deferred her response to the nosocomial infection and the official findings. Do you have the official findings for that?
Well, remember I discussed this already last week, that yes, nosocomial infections is not an uncommon occurrence for hospitals. Even in the best hospitals with all their protocols and all their policies, it happens.
Right. So
It can happen. And so we had that one individual who has already, it's publicly known that, she was here in the hospital, COVID negative. And then when she was tested, she became COVID positive.
and you just don't know if it was from a patient or a staff.
It's possible that because she had visitors and she had family and friends come and visit her.
And really, there's just no way of knowing.
It's hard to say. It really is hard to say, to pinpoint where exactly you get the infection.
Right.
All right.
Lillian, thank you so much for joining us, and our thoughts and prayers are with you. If you find out anything else about the 10-year-old boy or anything, I had to ask you this last time, are we anticipating any COVID patients, conditions worsening?
Well, they're like Dr. Uggan said this morning, they're really, really critically ill individuals. And so, like I said, there's about 12 of them on ventilator, 14 are ICU. So, as she said, anything can happen. They could be stable, then they can crash because it really affects their lung system, their respiratory system.
Right. And then she had also talked about the kind of a vascular component where it's going through the blood system and affecting other parts like heart attack, stroke. So that was, to me, that was pretty eye opening.
Absolutely. This virus is very brutal.
I've heard it called other things that we won't repeat this morning.
Okay.
Thank you,
All
Lillian.
right. Good job.
That's that. Okay, wash your hands. What?
You know she wasn't gonna say it.
That's
though.
me being classy. Hey, we'll take
Oh, yeah, and I'm not.
Yeah,
Yes.
okay. We'll take a short break. Miss Maria, Mark, thank you guys, and we're gonna get you on tomorrow, Miss Maria. So I appreciate that, Mark. I don't know if you got the memo there, but the chair just made a motion that you move the interview to tomorrow. So. And I seconded it. I'm not even on the board. So thank you guys. We can pop you on here. Thank you guys so much, and we'll catch up with you guys tomorrow. I hope you enjoyed the show, though. Being in the KUAM News Zoom room.
Not even gonna get a hello.
Well, I'm telling them to say hi and bye.
Chris and Brina,